Pain along the inner front and side of the thigh and knee can be caused by problems with the quadriceps. Watch this video to the end to learn the causes of pain and its distribution, exercises to quickly relieve discomfort at home, and helpful tips to prevent recurrence of pain. I'm Dr. Chernov. Let's get rid of this pain right now. The quadriceps is the largest and heaviest muscle in the body. It can weigh 50% more than the second heaviest muscle in the human body, the gluteus maximus. The quadriceps consists of the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. All four parts of the quadriceps are attached inferiorly by a common tendon to the patella, which is attached by the patellar ligament to the tibial tuberosity. Three muscles, the medial vastus, lateral vastus, and intermediate vastus, cross only the knee joint and are attached to the femur at the top. The rectus femoris crosses two joints, the knee and hip, attaching to the pelvic bone at the top. Trigger points in the rectus femoris are very common. Referred pain from these trigger points, located at the level of the hip joint, is most often felt deep in the knee joint and around the patella, as well as in the lower anterior thigh. The pain may intensify at night, causing serious problems with sleeping. In some cases, trigger points can be located in the lower part of the muscle, above the knee, referring pain to the knee joint. There are two areas in the vastus medialis muscle where trigger points most often appear. The first trigger point is closer to the knee on the anteromedial surface of the thigh and refers pain along the anterior surface of the knee joint. The second trigger point is higher and refers aching pain along the anteromedial surface of the knee and lower thigh. Long-term existence of trigger points in the vastus medialis muscle can lead to significant weakening of the muscle. The pain may be followed by a sharp weakness, leading to the leg buckling at the knee joint, which can result in loss of balance and injury. Also, due to prolonged tension of the medial vastus muscle of the thigh, the patella can shift inward and upward from its normal position. The intermediate vastus muscle of the thigh lies under the rectus femoris muscle, which makes it much more difficult to detect trigger points in it. The pain reflected from them spreads along the anterolateral surface of the thigh to the level of the knee joint, with the greatest intensity of pain noted in the middle of the thigh. Sometimes, in the presence of trigger points in the upper part of the rectus femoris muscle and the intermediate vastus muscle of the thigh, a symptom of buckling of the leg in the hip joint can be observed, which occurs with simultaneous extension of the knee and hip joints of the leg on which the body weight falls. Also, if the intermediate vastus muscle of the thigh is affected, difficulties may be observed in fully straightening the leg at the knee joint, especially if the leg has been motionless for a long time while sitting. The vastus lateralis is characterized by the development of multiple trigger points along the lateral aspect of the thigh. Its 5 trigger point areas can refer pain along the entire length of the thigh on the side and along the outer aspect of the knee. If trigger points cause pain in the upper thigh, the person cannot lie on the affected leg and sleep on the affected side. With prolonged tension of the vastus lateralis, the patella can move outward and upward from its normal position, which can result in immobility in the knee joint. The pain from the first group of trigger points radiates to the knee joint area and sometimes along the back of the knee. The second group of trigger points is located somewhat posteriorly and causes pain to the side of the patella, and the referred pain covers a large area up the lateral surface of the thigh and down the lateral surface of the shin. The third area of trigger points refers pain along the entire posterolateral surface of the thigh, as well as to the lateral part of the popliteal fossa. The fourth group of trigger points is located in the middle parts of the thigh and causes excruciating pain along the entire lateral surface of the thigh, radiating up to the level of the pelvic crest and down to the level of the patella. The fifth area of trigger points, located in the upper parts of the muscle, refers pain only in the immediate vicinity. Trodson, in his study, found in all 35 patients with damage to the knee area painful compacted areas along the lower part of the lateral vastus muscle of the thigh on the affected side. In 24 out of 25 patients who underwent treatment of the lateral vastus, instability of the knee joints regressed. This and other studies once again confirm the phrase that I regularly repeat in my videos. If your knee hurts, then in addition to a full diagnosis aimed at identifying or excluding rupture of ligaments, meniscus, and other causes, be sure to treat the muscles and fascia of the thigh and lower leg to prevent the development of arthrosis of the knee and hip joints. To independently assess the range of motion of the rectus femoris, it is necessary to simultaneously flex the knee and extend the hip. If the range of motion is full, then with maximum flexion in the knee and extension in the hip, the heel will touch the buttock area. To independently determine the mobility of the three vastus muscles of the thigh and assess their elasticity, you can use the following test. Lie on your back and bend one leg at the hip joint at 90 degrees, thereby preventing stretching of the rectus femoris. Then grab the shin of the bent leg and pull the heel to the buttock. If it touches it, then the medial, lateral, and intermediate vastus muscles of the thigh are of normal length. If the heel does not touch the gluteal area, then most likely there is a problem with the intermediate vastus muscle of the thigh. Trigger points in the other two vastus muscles cause less restriction of movement. When treating trigger points located in the quadriceps muscle of the thigh, you need to pay attention to two processes. Firstly, it is necessary to eliminate long-term harmful factors and restore optimal body biomechanics. And secondly, it is necessary to exert strong mechanical influence on the area of trigger points with subsequent muscle stretching. Work in the first direction involves eliminating acute or chronic muscle overload caused, for example, by a set of exercises that include squats or professional sports activities, such as jumping while playing basketball, volleyball, football, jogging, skiing, rollerblading, cycling. It is necessary to exclude prolonged immobile positions of the body, such as sitting near a computer or driving a car with the legs bent or conversely straightened, such as while watching TV. It is necessary to avoid positions with prolonged kneeling. It is necessary to work on eliminating flat feet, accompanied by excessive pronation of the foot, as well as correctly placing the foot while walking, eliminating the deviation of the toe to the right or left from the center line. At home, the second direction includes mechanical action on the area of the medial, intermediate, lateral vastus and rectus femoris muscles, using a large massage roll or a 2-liter bottle filled with warm water, as well as a massage ball. Take a bottle of warm water or a large massage roller. Get down on the floor and place the massage tool under the area of the front surface of the right thigh. Leaning on your hands and left leg, slowly massage the front surface of the thigh for 2 to 3 minutes. Rotate the thigh slightly inward and outward to massage the adjacent areas of the muscle. If you find areas of increased tension and pain in the muscle, stop there for 30 seconds, and then again perform a massage movement forward and backward. To enhance the mechanical effect on the area of trigger points, you can bend your right leg at the knee or lift your left leg off the floor and place it on top of the right. After working on the front surface of the thigh, turn on your side, lean on your right hand, bend your left leg, and place your foot in front of you. Massage the lateral surface of the thigh for 2 to 3 minutes, changing the angle of impact on the muscle. If there are areas of compaction in the muscle and increased pain, stay in the problem area for 30 seconds, and then massage the muscle again with forward and backward movements. To increase the mechanical effect on the lateral surface of the thigh, you can lift your left leg off the floor and place it on top of your right. Be sure to work on the opposite leg on the massage tool for the same amount of time. To further enhance the mechanical impact on the trigger point area, you can use a small or large massage ball together with a massage roller. It is more convenient to work on the front and side surfaces of the thigh on a large ball. Press on the area of increased pain for 30-60 seconds. Try to breathe deeply through your nose, and with each exhalation, relax the muscles of the thighs. After working on a large or small massage ball, massage the front and side surfaces of the thigh again on a massage roller for 1-2 minutes. After this, you need to stretch the muscle. The quadriceps muscle of the thigh extends the lower leg at the knee joint, and due to the rectus femoris, flexes the thigh at the hip joint. To stretch the medial, lateral, and intermediate vastus muscles, you need to bend the lower leg at the knee joint. And to additionally stretch the rectus femoris muscle, you need to straighten the thigh at the hip joint. The simplest exercise is lying on your side. Bend one leg at the knee, grab your foot with your hand, and bring your heel as close to your buttock as possible. If your leg bending is very limited and you cannot grab your shin with your hand, use a belt. Feel the muscle stretch, breathe smoothly and deeply through your nose, and hold this position for 1-2 minutes. After that, do several cycles of active leg movements, bending and unbending it at the knee and hip joints. Turn over to the other side and be sure to repeat the exercise on the other side. A similar exercise can be done while sitting. This is especially convenient if you spend a lot of time at the computer. Place your pelvis on the edge of a chair, bend your leg at the knee, grab your foot or shin with your hand and bring your heel to your buttock. Hold the final position for 1 to 2 minutes. The same exercise can be done while standing. To maintain balance, do it near a wall. More complex but even more effective exercises that allow you to intensively stretch the quadriceps are Vajrasana, diamond pose in which the pelvis is placed on the feet, Virasana, hero pose in which the pelvis is located on the floor between the feet, as well as any other exercises in which these body positions are used as an integral component. For example, fish pose, Ardha Bekasana or full Bekasana, frog pose. It should be noted that you should not have problems with your knee joints to perform these more complex exercises. One of the best exercises that helps stretch all four parts of the quadriceps as well as the iliopsoas muscle is the following. Kneel on the mat and place the foot of your left leg in front of you. Bend your right leg at the knee, grab it with your right hand and bring it closer to your buttock. You can use a belt and a yoga loop. If you feel significant discomfort in the knee joint of your right leg while doing this exercise, place a towel or blanket under your knee. Hold the final position for 1 to 2 minutes. Breathe smoothly through your nose and feel the stretch in your muscles. Then be sure to repeat this exercise on the other side. When treating trigger points in the quadriceps, you also need to work with 3 muscles on the back of the thigh: the semitendinosus, semimembranosus, and biceps femoris. A video about these muscles will be published in this playlist, so be sure to subscribe to the channel. I would be glad if you liked this video and shared it with your friends who suffer from leg pain. I wish you good health and see you soon.